Anorexia nervosa is the restriction of energy intake, resulting in a considerably low body weight. These individuals usually have an intense fear of gaining weight and use behaviors that attempt to interfere with this potential weight gain, such as excessive exercise. When energy in the body is low, very little is used in growth and reproduction, resulting in a loss of menstrual cycles and can have adverse effects during pregnancy. Solmi and colleagues conducted a systematic review on low birth weight and offsprings of women with anorexia. They proposed a hypothesis that predicted full-term children of anorexia nervosa mothers weigh less at birth than those of unexposed women. The main research question of this paper is how does anorexia nervosa and reproductive age women affect their offspring's birth weight? 9 studies were included in the systematic review, 6 were experimental and 3 were observational. All studies included in the paper only looked at diagnosis of anorexia nervosa and low birth weight. 5 used data obtained on exposed women from patient registers with diagnosis made by clinicians according to the DSM-5 criteria. 1 used a community-based sample with anorexia being diagnosed against the DSM-4 criteria. 3 used self-report measures via questionnaires and relied on patient reporting. They found that women who were from patient registers or clinical samples with more severe cases showed to have a large mean difference in birth weight of negative 0.2 kilos compared to unexposed women. In all studies, they found that the reported gestational weight gain and maternal pre-pregnancy BMI was a lot lower in those who were exposed compared to unexposed women. Women who were exposed had an average pre-pregnancy BMI of 18.2 and a mean gestational gain of 14 kilos. Whereas women who were unexposed had an average BMI of 24 and a mean gestational gain of 17. It was also found that it is possible for exposed women to have offspring with a normal birth weight, as weight recovery could partially offset the mechanism of low birth weight. However, this varies on the severity of the disorder. Individuals with anorexia account for 2.5% of Australia's population, and 1.8% have maternal complications. Minimizing these is important for socioeconomic benefits and will help to improve gestational health. A small limitation is due to case identification of the exposed women varying across study settings. However, this is very small due to diagnostic criteria hardly changing over time. Future focus should look at pre-pregnancy BMI and gestational weight gain in order to better explore the associations of these two factors with birth weight and other perinatal outcomes in mothers with anorexia. Interventions need to be researched to help these women maintain a healthy weight to avoid maternal complications for both the mother and the developing fetus.